Hi, everyone. Thanks so much for joining me for the next topic in our series on healthy heart, healthy brain. We've been focusing lately on women and heart disease during this series. And today we are going to cover what are the top 10 heart disease prevention tips for women. Okay. And we are using that book, Healthy Heart, Healthy Brain by Dr. Bradley Bale and Dr. Amy Doneen. For those of you who don't know me, my name is Linnea Baker, and I am a board certified family nurse practitioner. Thank you so much for giving me some of your valuable time tonight, and I am grateful for each of you for showing up. So the number one thing we need to do when we look at the top 10 ways to prevent heart disease in women is we need to get educated, okay? Nearly 300,000 women in the United States die every year from heart disease. And we can break that down to be one woman every 60 seconds, guys. That is staggering statistics. So this is real, and we need to understand how this impacts us as women, because for so long there was a stereotype that this was a disease of elderly and especially older men. And we have talked about that over the past week. So if you have not been following the series, I encourage you and urge you to go back and watch from the beginning of this series, because there's lots of statistics and information for both men and women in this. We need to advocate for ourselves. There's an American Heart Association Go Red for Women campaign that I got to be a small part of when I lived in Hawaii and worked in cardiology with some cardiovascular doctors that were female. And we even got to participate in one of their conferences on Maui, which was very empowering and impactful. So this is near and dear to my heart, no pun intended. And there's lots of resources out there to help us, empower us to advocate for ourselves and get educated. Over 670,000 women with family history of heart disease, so that genetic history, saved their own lives by making healthy choices. There were 300 fewer deaths per day among women with higher genetic risk that got educated and made healthy choices. So this is something that is largely able to be impacted by what we do in our lifestyle, and by being aware and educated, and by being proactive and taking care of ourselves, we can make a huge impact on our overall health and longevity, guys. So number 2, we need to move more. The American Heart Association and then the Bale-Doneen method both recommend 150 minutes of moderate physical activity per week. And we're talking about walking or jogging or biking or swimming. And that's just to get the heart rate up. And there's just so much great information about movement and how good that is for our overall health. I know I try to walk every day. I try to walk for exercise. And I do that probably 5 to 6 days a week minimum. And it impacts your overall health in so many things. But this is coming from the cardiac standpoint of cardiovascular disease prevention, that we should be doing this 150 minutes per week. So if you did 30 minutes 5 times a week of walking, jogging, biking, or swimming, that would meet that. Now, there's a recent study showing that just losing 2 inches from your waistline can significantly reduce your blood pressure, your cholesterol, and other heart attack risks. So we're not even talking about a weight number. We're talking about just losing inches is going to impact your overall health, okay? And just FYI, according to Dr. Bale and Doneen in their book, and I always say this as well to my clients, always check with your medical provider before starting a new workout to make sure it's right for you. They know you best, so you definitely want to check in with your personal medical provider or healthcare provider before starting any new workout. Now, number 3, we want to follow a healthy lifestyle. And you guys know who have been showing up with me. That's my absolute passion. There's so much research in this. I have completely changed my trajectory of my health and wellness, and so many others, just in helping people on a holistic and sustainable healthy lifestyle. And I'm not talking about restricting calories or feeling restricted or counting macros, just a sustainable, healthy, holistic lifestyle. And that's really my jam and my passion and what I love to do. So in this, they say that living an optimal lifestyle reduces heart attack and stroke risk by up to 90%, guys. This is a disease of our lifestyle. That's why it's getting worse and worse, with our country being like 60 to 70% of the food the average adult eats every day is ultra processed. And that's why we're seeing these chronic illnesses increase, especially heart disease, as we've talked about. High sugar diets, which is the mainstay of the American Western diet, unfortunately. High sugar diets have shown to triple the risk of fatal cardiovascular disease. Diets high in fruits and veggies have the opposite effect. And I never used to think I'd be a fruit and veggie girl, but I tell you, I've cracked the code on how to do this and make it easy, and you will crave fruits and vegetables, and you will not want the sugar anymore because you will feel so good. I promise you, if I can do this, anybody can do this. And then maintaining a healthy weight, just losing 7 to 10 pounds. 7 to 10 pound weight reduction reduces your risk for type 2 diabetes by up to 70%, even if you're already pre-diabetic. That's so powerful, guys. So powerful. And just impressive. And a lot of people that go on a health journey with me, when I started my health routine, I lost 18 pounds in 1 month. My husband lost 15 pounds in 1 month. A lot of people will lose 10 to 20 pounds, just depending on where they're starting and what their goals are and what they're needing and what their personalized plan is. But, and we don't focus on a weight. That's kind of a byproduct of what we get when we have a healthy lifestyle in place. And then stress nearly triples your heart attack risk. So a lot of us are under chronic stress with work and in life, and just trying to live day to day in the United States and in our present climate of everything that's going on around us and all the access we have to technology to see just be overwhelmed and inundated with things 24/7. So just being mindful that stress will triple your heart attack risk. So we want to work on stress management as part of our holistic, healthy lifestyle. Okay. Now, number 4, no nicotine. And this one is pretty common sense, right? Smoking and other forms of nicotine, such as vaping and chewing tobacco, triple the risk for fatal cardiovascular disease. It triples it, guys. Young women who smoke are up to 13 times higher risk of heart attack than those at the same age who do not smoke. That's a pretty powerful statistic. And they're saying even 1 cigarette a day increases a woman's risk for heart attack, stroke, cancer, and early death, even just 1 cigarette a day. So if you are a smoker or you're vaping or you're chewing, just quitting that habit is a powerful first step towards your overall health, guys. And the CDC reports that secondhand smoke kills 41,000 people in the United States every year. And that's secondhand smoke. That's even people who just are around it, like kids and adults, not necessarily people who are smoking themselves. And heart disease accounts for nearly 34,000 of these deaths. So the secondhand smoke exposure is putting people at risk of heart disease, which is pretty powerful, that what you're doing can be really impacting the ones that you love around you. And working in pediatrics, we talk about third-hand smoke too, which is even if you smoke outdoors, having a different cover on over your clothes, a shirt or something that you take off, because there is nicotine and things on your clothes. So if you have a baby and you're holding the baby after you smoke outdoors, they're still being exposed. So there's a third-hand smoke exposure as well. Checking blood pressure. So important, guys. Nearly 50% of US adults have high blood pressure. And they say that high blood pressure is equal to 130/80 or higher. And an elevated blood pressure is when the top number is 120 to 129. Okay. So high blood pressure is highly treatable. It is a symptom of chronic inflammation. It's something that we work on when I take people on a personalized health journey and get their gut healthy and decrease their chronic inflammation. We can also make an impact. I can't say treat or cure, but we do make an impact with healthy lifestyle. And they're citing this right here in this studies and in this book, this evidence-based book, that high blood pressure is highly treatable with a healthy lifestyle by losing weight and having diet and lifestyle changes, which is what my focus is. And in many cases, people do need medication. And sometimes they need medication for a short time to get it under control. Sometimes they need it for a long time. It depends on the person and how much they're doing with their lifestyle, and working closely with their healthcare provider to make sure that they're taking care of themselves and doing whatever they need to do and being safe and managing their blood pressure. So it is important that you discuss your blood pressure numbers with your medical provider and come up with a plan if you have elevated blood pressure. So today we're going to stop here because I don't want to overwhelm you with too much information. And next week, we're going to cover the next 5 of the top 10 prevention tips for heart disease in women, preventing heart disease in women. And that'll be next week, the second 5 to finish up the 10. But today our action steps are, let's empower and educate women. You can help me reach women by inviting 5 women to this health and wellness group who need to hear this. We all need to be educated and empowered to advocate for ourselves, and you can make a difference in your friends and families and loved ones' lives. So tag the women in the comments of this video so they can hear about the top 10 tips to preventing heart disease in women and invite them to this group. Okay, that's our action steps today. And just remember, guys, I'm on a mission to positively impact your health and wellness through education and coaching to create generational health, guys. Remember, as women, we lead our households. We're usually the ones that do the grocery shopping and meal planning. If I create health in you and teach you healthy habits, it trickles down to your children and impacts future generations. So generational health. And I also want you to have a health span that equals your lifespan. Too many people in the United States associate age with being ill, having chronic disease, being weak, maybe being in a wheelchair or debilitated. And we do not have to age that way. We can age gracefully by taking care of ourselves. And not expecting ourselves to be weak and debilitated, but doing the things we need to do now to live a vibrant, healthy, high quality life for as many years as we get to be here. Okay. Reach out to me for a free health and wellness consult by commenting below, or you can private message me. I would love to get to chat with you on what your personal health goals are and help you on making some changes towards your optimal health. Okay. And this is the book, Healthy Heart, Healthy Brain, by Drs. Beld and Dr. Doneen. And I got this off of Amazon. Like I said, I don't have any attachment to this book. I have nothing associated with it other than it's powerful, it's evidence-based, it's holistic, and it covers a lot of things that I was seeing back when I worked all those years in cardiology to empower lay people. It's not even for healthcare providers. This book is written for people who have no medical background to empower you to advocate for yourself, to be aware of what you can do to impact your overall health from a heart standpoint and a healthy brain standpoint. So I encourage you to get the book. Okay, guys. And I just want to say thanks again. I am so grateful for you giving me some of your valuable time. I know it's valuable, and I do appreciate every one of you that show up and listen to this, and I hope it brought value to you. My goal is to empower you and bring education that can help change your own personal health journeys, okay? Until next week, be safe, guys, and I will see you soon. Take care.